Hello everyone, I'm John Higgins. This is PNG Tonight. Coming up, at least 2 men have been diagnosed with breast cancer as doctors also see an increase in the same in women. Frightening still is the lack of proper data in Papua New Guinea on all forms of cancer. And Varirata National Park on the Sogeri Plateau, soon to be a bird watching destination. Worrying news that breast cancer is on the increase in Papua New Guinea, and that's not all. 2 men have been diagnosed with the same, the first in this country. Specialist surgeon of the Port Moresby General Hospital, Dr. Arnold Wayne, says all forms of cancer is a death sentence here. There is no national counter plan, no database, nor a proper treatment center. I talked to Dr. Wayne today. Doctor, thank you for coming on to the program.
Thank you very much, Mr.
Okay,
Higgins.
you're a special surgeon and you see a lot of cancer patients at the Port Moresby General Hospital. Papua New Guinea is vulnerable to a lot of cancer types. What sort of patients do you treat? Just tell us the cancer situation in this country.
Thank you very much. Cancer definitely in this country is becoming a bigger problem than what we will probably anticipate or what we will just see over the surface. The reason why I say this is because at Port Moresby General Hospital, where I work as a specialist surgeon, cancer basically affects a lot of people, both adults and kids, children.
Okay.
And when they come in, we have different sections where cancer patients will go. Okay. Especially the ladies' side, they go to obstetrician or gynecologist. Yeah. The kids, the children, they go to the children's doctors to look after them. I look after the ones that also got, breast issues.
That's what you specialize in.
Intestine cancers, cancer of the chest, the lungs, the bones. So this is the area where I often look after them at the Port Moresby General Hospital, which is the biggest referral hospital for the country. Yeah. So I get patients not only the NCDC population, but the central province, the Gulf province, and outside centers, they come in.
Okay.
So
okay.
I have big numbers in terms of cancers.
Sure.
I deal with them every day.
When you say big numbers, increased number of patients that you see all the time.
Definitely.
Okay. Why is it? I mean, it's a disease. Is there enough awareness out there? What do you see the trend as? Is it increasing? By how much, if you will?
For breast, particularly for the last 2 years that I've been looking specifically on the breast cancers, I'm seeing, and I'm in a record for the last 8 years, 68% increase.
Wow.
So when I say 68%, it's gone up to 70. If 10 people come into my clinic at Port Moresby General Hospital, out of the 10 people with breast lumps, 7 of them will be cancer, and 3 will be because maybe infection of the breast or something else. So that's the kind of number you can, you can think about when I say it's going up to 70% increase. Wow. So that's the number I'm looking at, and it's a frightening thing. And most of the times the patients ask me, so what can we do? What happened? I mean, how do we get these things? And I'm telling them, like, I can't say, it's this and this because of this and this cause. There's no 1 + 1 = 2 thing. The matrix is difficult. It's multifactorial. It's many factors.
What sort of women are you seeing with breast cancer? Are those who live in urban centers and exposed to Western styles of living, or the rural setting?
I'm seeing anyone, from the rural scenarios and the ones from town also. But increasing numbers from within town areas, I think they're conscious about their health, we can say that. And so they need to go to the hospitals are very close by, so they go to the hospital, a doctor and nurse sees them. The ones in the rural areas, they are there. Yeah. But it's difficult to come in terms of the transport, fees and bus fares, PNVs. So when they do come in, yes, we are seeing them. And so we're also thinking that this probably is sampled, and there are a bigger number somewhere within the within the rural areas of Papua New Guinea. Okay. So we are seeing not only the ladies from town, but we're also seeing the ladies also from the rural areas or semi-rural areas. Yeah. And not only ladies, gentlemen, not only ladies. We are seeing guys with breast cancers.
True.
Yes.
Men with
breast cancers. I've seen 2. I've treated them too.
Wow.
So
That's almost unheard of.
definitely, I've never thought that this. I've been practicing as a surgeon for the last 8 years. I've never seen breast cancer in male, and recently, last 2 years, I've seen 2 in 1 year. 2% with 1 year. So I'm now thinking, so what are we doing? I mean, what the hell is going on?
Are we unique in this country? Have you heard it in, say, Australia, New Zealand, elsewhere?
They have it, and you
Okay.
think that it's not like part of us, but we're having now in our country. So I've seen 2.
Okay.
Maybe that's not that's insignificant, in terms of stats, but however it is, we're seeing the
Yeah,
Indian.
okay. It does say something about perhaps how we live, what we eat, what we're exposed to, all of those things.
I think so. Because some of these factors we're looking at, and I said, we're seeing more ladies from the town area coming in with this problem. So now we are thinking that the lifestyle diseases they talk about in terms of there's blood pressure and sugar, and
Sure.
breast cancer is also becoming a part of lifestyle diseases.
Okay.
So now we are looking at in terms of what kind of food is causing this. Science is still, trying to.
So then we've got these rural women who are more vulnerable than, the women in urban areas are more vulnerable now than rural, if it is a lifestyle thing.
Yeah, one of the bigger things is that they've seen the ladies within the rural urban communities smoke, beer.
Yeah.
So those kind of behavior, things, they depress the immune system in the body.
Yeah.
So when that happens,
Self-inflicted. All right. Okay.
when that happens, the chances of the cancer cells they come in. They know that's the only time. So we are now saying, in the bigger sense, they said cancer, and cancer is like smoking is a big factor, alcohol is a big factor, and they said some excessive fats. And excessive fats, there's a reason why they said, because it contributes a lot of estrogen production, that hormone production.
Yeah.
And estrogen is not, like it provokes the breast tissue to change. So it's more to do with lifestyle, and those commonest ones they can say is the smoke and alcohol. But a bigger factor also, one of the associated factors is genetics.
Okay.
Mom and auntie has got
Passed down.
Yes, they have some genes that's passed down to the blood. Genes. So the daughter will probably more likely to have a cancer.
Okay.
And maybe breast
Well,
cancer.
from what you've seen in the last 8 years that you've seen patients like that, is it lifestyles? Is it genetics? What trend is that?
It's very difficult to have a genetic association because we don't have records of past events in our health system. In our one auntie died in the village, they said, it's a sorcery. They just say sorcery.
Okay.
Because we don't have a good medical archive system, a database system where we can follow up and say, your auntie died from this, so now that we got the biopsy, it's because I think there must be some genetic linkage.
Yeah.
We don't have that, but from general assumption, general consensus, we can say they are genetic. In fact, Australia, America, they have genetics.
Yeah.
They have good database system, unlike us, but we just follow their trend. We also say that lifestyle diseases and stuff like that. Yeah.